So minimally invasive surgery is an approach to conducting an operation that really began in the late 80s, early 90s. And it's an approach where we use very small instruments and cameras to conduct an operation without doing a very large open incision. More recently, minimally invasive surgery has been adapted and modified so that we can do it in very small children and even newborns. As we've gotten better and better at advanced minimally invasive surgery for small children, we've learned some new techniques and new approaches that have really brought this technology to even the smallest of children. Some examples of the kinds of operations we do include things that may be familiar to people already, such as appendectomies and cholecystectomies, or removal of the appendix, removal of the gallbladder. More recently, the operations we've become capable of doing include newborn surgery and more complex congenital operations. Some examples include congenital diaphragmatic hernia, or esophageal atresia, or duodenal atresia, and operations such as these. These new advances have really only been in place for the last 10, 20 years, and we're really at the forefront of conducting these operations here at Johns Hopkins. So some of the approaches and some of the techniques we offer here are laparoscopy, which is an operation on the abdomen using the camera and the small incisions, thoracoscopy, which is an operation in the chest using the camera and the small incisions, robotic surgery, which is the same idea as laparoscopy or thoracoscopy, except it is using a robot to provide some enhanced capabilities that we might not have with some of the traditional minimally invasive surgical techniques. The other thing we can provide is endoscopic surgery, which is an operation where we insert a camera and small instruments through, say, the mouth to get into the esophagus or stomach, and we can conduct procedures in that way. And we can combine these procedures with other procedures. So we can do endoscopic and laparoscopic, or endoscopic and thoracoscopic, and we can combine these in creative ways to solve a problem. Another example of an operation what we do is minimally invasive inguinal hernia repair. And so that is an operation that we do both as an open operation and a laparoscopic operation. And we would make a decision at the time of surgery which was the best approach for your child. And it might be even a combination of the two, using the camera to make a diagnostic decision about whether to proceed laparoscopically or whether we should do the more traditional open operation. Either way, we're going to choose an operation that ensures the best possible outcome with the highest success rate and safety and well-being of your child. Every operation, whether it's a minimally invasive operation or a traditional open operation, they really carry the same risks. In fact, we don't conduct minimally invasive operations if we think there are any additional risks to the patient. So what we really try and focus on is matching the gold standard of the historic success rate of an open operation with the minimally invasive operation, but also allowing for the benefits of the minimally invasive operation. In fact, many minimally invasive operations have greater success than the open operation used to, and we're able to do things that we couldn't do before. Some of these advances include the size of the camera that we can get into spaces we couldn't see easily before from an open operation. And we can do things like sort of look around the corner and take a different angle to an operation that was not available to us before. One of the additional advantages is the camera allows for magnification. And so what this means is we can see a larger image of what we're operating on than we could see with the naked eye. That image, it can be projected onto a screen or a monitor, and that also allows us to see it on a larger scale. So something that inside the abdomen might be the size of an egg is now projected on a screen that is a large TV screen. One of the other advantages of this is it really facilitates teaching as well, and it allows other learners to see what we're doing while we're operating, even if they're not in any way participating in the operation. They can observe the surgery much more easily, and they also can learn from the advanced techniques we're applying in these situations. So the greatest benefits of the minimally invasive operation is really the fact that we're using very small incisions. So the traditional minimally invasive surgery uses a 5 millimeter or half centimeter incision, and that's about the size of your fingernail on your pinky finger. We now can use even smaller incisions that are 2 or 3 millimeters, so about half that size. By using smaller incisions, there's less pain, a faster recovery, and less scarring. This is really a great advancement for patients because they're able to go home from the hospital sooner. They require less pain medicine. We're able to avoid narcotics, especially in children. And cosmetically, the operation leaves smaller scars. And so it's a nice way to solve a complex problem with a lot of benefit. Really, the risks are not all that different than an open operation. And in fact, if we are unable to complete an operation laparoscopically, our approach is to move to the traditional open operation. And so really the risk profile, in essence, is the same unless we're benefiting from the minimally invasive approach in being able to reduce that risk profile. So the benefit to the patient is the potential for a less painful operation with maybe better visualization, greater success for certain portions of the operation than we could have had before. So Johns Hopkins Children's Center really has probably the largest group of surgeons in the Mid-Atlantic who are capable of not just minimally invasive surgery, but advanced minimally invasive surgery. And so we're really bringing this to the table for all of our patients as an option. It may not be the best option for every procedure. It may not be the best approach for every operation, but when it is, we have the ability to provide this as an option to families and to patients. So we have a very large group of surgeons who are capable of this advanced minimally invasive surgery. And in addition, we have the ability to collaborate in creative ways with other surgeons to provide an operation that may combine different types of minimally invasive surgery. So we could do a combined procedure, for example, with a ear, nose, and throat surgeon or a gastroenterologist in a way that really allows for us to creatively solve a problem and to really address something in a way that we might not be able to do in a hospital that did not have these capabilities. The other thing that's exciting about minimally invasive surgery at Johns Hopkins is we're constantly looking for ways to improve upon this and to really advance this field. We're always ensuring that we stay right at the cutting edge of knowing what can be offered safely to a patient and to a family. We really strive to make sure that we can provide these approaches to an operation with no decrease in the safety profile, the opportunity for success. Really, safety and the best possible outcome is our primary focus. So even though we have these opportunities to provide advanced minimally invasive surgery for a child, we're going to choose the best operation for the situation that will give us the best chance of a positive outcome, the shortest hospital stay, the least amount of pain for a child. So while this may not be the approach for every operation, this may not be the approach we use when we have a discussion for every single procedure, we are always thinking of this as an option and whether this would be the best approach for your child.